More and more public schools are now asking the state for permission to drop their face mask mandates. Here to answer your questions about that and a lot more, Dr. Shira Doron, the hospital epidemiologist at Tufts Medical Center. Good to see you, doctor.
Hey, Dr. Doron, great to have you with us. So as we have been reporting, schools that have at least 80% of their students and staff vaccinated can apply for an exemption to the state's masking requirements. So let me ask you, what's your advice to school administrators who do get that approval?
You know, this issue is incredibly divisive and only getting more so. Families and staff have very strong feelings about whether to drop mask mandates. And I think few people really give thought to exactly what the threshold should be to do it. And the answer can't be never. And yet the virus is never going away. So my advice is to educate the school community on one-way masking, which is the idea that if you use a very high quality mask, you can protect yourself if you're high risk or risk averse, even if others aren't wearing a mask.
Okay, so jumping off of exactly what you just said, the state made these rules long before we even heard about the Omicron variant. So knowing what we know now, in your professional opinion, do you think that 80% threshold needs to be higher?
Well, I think it needs to be updated, although I'd like to see a 100% vaccination rate in schools. The 80% threshold was based on the effectiveness of the vaccine against infection by prior variants, and there really isn't a metric or a threshold that makes sense to me anymore for the end of a mask mandate. With vaccines available to everyone over the age of 5 and one-way masking as an option, I think if this wave ends with low cases and high immunity, that's probably as safe as things are going to be for a while. And then it would be the right time to make masks optional.
Yeah, well, you know, Dr. Doron, in the world we live in, you're not going to get 100% of the people to agree. Today's Wednesday, so let's move on from there. We're hearing from a lot of viewers who are losing their empathy for people who aren't fully vaccinated yet. In Massachusetts, that's still about 25% of the population. Do you share that frustration, and how do you handle it if you do?
You know, we in healthcare always take care of people who've made choices in life that we didn't agree with and which negatively affected their health. I have compassion for people who aren't vaccinated because they've heard some piece of misinformation that they believe, and that doesn't make them a bad person. But it does mean that we have to keep trying to reach every last person with education and access to vaccines.
Let's get to a question from a viewer. Her name is Deborah, and here's the question. My 10-year-old niece hasn't slept over my house since the pandemic started. I'm now boosted. She's fully vaccinated and recovered from COVID last month. Is it safe to let her sleep over?
Well, safe is a relative term, and what I consider safe and what you consider safe might be different. But someone with recent COVID during the Omicron surge who's been vaccinated has what's called hybrid immunity, which is strong. So your niece is one of the safest people you can be around right now.
Dr. Doron, thank you so much for your time.
Great to see you as always. Thank you, doctor.